For instance, here in the hospital alone for the last 3 months, we have had about 27 attempted cases of suicide. And this is really a high number, basically to demonstrate the amount of stress that people are going through. And what we are recommending is that people who are having levels of stress, they need to come out for clinical care. As a Department of Health, we have now capacity built enough health workers. For instance, we have 1 psychiatrist assisted by 7 psychiatric nurses and 4 clinical officers trained in psychiatry and mental health to assist the members of the public who will come forward with such problems. We are still moving forward to equip the facilities into optimal level so that they can be able then to assist those who are in need. But I think more importantly, as we are noting, there are a lot of challenges that are coming forward, especially at family level, where maybe spouses are having communication breakdown, and one deciding to kill himself or herself or kill the other members of the family. Basically, these are signs of uncontrolled stress, and therefore we are urging that households that are going through a communication breakdown of whatever level, as long as they cannot manage it, they need to share with their whoever they trust, either a friend or a pastor. But if they cannot, then they need to come forward to our health clinics and facilities. We have now put in place counseling facilities that can then be able to be of help to them. And those that require more advanced treatment, then we can be able to refer them through the system.
The public and our parents, our children out there, that we are here to assist, we are here to help. And mental health is not stigma. It is not something to be ashamed of. It is something to come up and accept. Accept help, accept there's a problem, and we will work with you each and every step of the way. It is not easy, but we're available 27 days, 24 hours a week, 7 days a week. We are here to assist you in every step of the way. The hospital is open. We have nurses here. We have doctors here who are available to assist us. Let nobody be depressed and suffer in silence in the community. Let people stand up and say no to stigma in matters depression, and stand together as a unit to avert it.